Good afternoon, everyone, and thank you for joining us for day two of the Boys Town Pediatrics Spring Newborn Expo. My name is Gabby, joined here today with Dr. Micah Ryan, a board certified pediatrician at Boys Town National Research Hospital, or Boys Town Pediatrics, excuse me. Dr. Ryan, how are you doing today?
Good, thank you. How are you?
Good. It's great to have you. Today, we are going to be talking about common infant illnesses. So, if you are watching live, make sure you like this video and leave a comment below to be entered in today's giveaway. We'll be giving away a prize here at the end. And if you have any questions for Dr. Ryan, you can leave those as your comment, and that will count for your giveaway entry. And also, I want to mention too, if you're watching live and you maybe haven't announced your pregnancy and you want to keep it private and not comment live, you can always message our page directly and we will count that as an entry. So thank you so much. Here we go. So the first question is, Dr. Ryan, is what are the signs of illnesses in newborns?
Yes, no, that's a great question. You know, uh, the hard thing is, when you bring home your little newborn baby, you don't know your kid yet. You don't know how they're always going to be doing illness. The easy ones are going to be a fever, 100.4, or if it starts getting, pretty low, 96.5, less than that. That's an easy one. That's probably going to be the one thing that we're going to tell all of our parents to be looking for. Um, what other things you start seeing? You start seeing that they're not feeding like they normally do, and so they start feeding less. Maybe they're sleepier. Obviously, they're gonna cry, but babies all cry, so you can't really always use that. They're not gonna be pulling on an ear. They're not gonna be, doing a lot of the bigger kid kind of things. And really, at the heart of this is it's gonna be, I hate to say gut instinct kind of stuff here, but this is something I tell all my moms now. Sorry, dads, this is we don't have this, but moms have it's kind of like a Spider-Man sense, a Spidey sense. That's a mommy sense, and you know, they just know when something's not right with their babies. And I always tell all my moms, listen to your gut instinct. If you don't feel like something's quite right, easy call. Let's bring them in.
Wonderful. The next question is, what illnesses should we be aware of in newborns? So the most common ones I think people think of are RSV, COVID now, if you want to touch on those.
Yes. Well, really, for a newborn, now this is a little bit different than, say, a kiddo that's a month old or 3 months old or 6 months or older. Really, when you talk about the newborn phase, any illness is going to be an illness you need to worry about. Especially that less than 1 month kiddos, that's kind of a magic number because really any fever of any sort before that age is actually considered a medical emergency. It's actually kind of a really big, scary thing. Our babies are not just getting bigger; things are still forming and growing. One of those things is this thing called a blood-brain barrier, which really stops anything from that's in the bloodstream to get from turn into like a meningitis. And so we take any kind of a fever, any illness of any sort, really seriously that first month of life. And so, really, any illness is going to be a big deal. But you kind of touched on some of these bigger ones like RSV. RSV is a terrible, 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 terrible virus. Puts a lot of kids in the hospital. And if there's any parents that have had other kiddos out there listening, you can probably remember that was probably the one illness that you're going to compare every other illness to. Um, I say this jokingly, but things have changed since the COVID. This post-COVID apocalypse of illness. Everything's different. Everything's doing things at different times. But doing things at different ages. My goodness, I was having my patients getting RSV and getting very, very, very sick, hospitalization sick even. RSV used to have a season. It'd really be more the December through kind of in any now. But we've been seeing RSV year round, so there's no real seasonality to this anymore. But RSV is a big one. What does that look like? A lot of mucus, breathing, really working hard to breathe. A lot of times they're wheezing. They're not feeding either. Those are some of the big ones. In addition to those fevers, we're also seeing things like influenza. Now, thank goodness we are starting to get out of our current influenza season, but that's a terrible one. That's high fevers once again, and that can be a whole multitude of everything in between. We've been having currently hand, foot, mouth going around all the daycares, and these are the little mouth sores and these sores are on their palms and the soles of their feet, which are actually very unique areas for rashes because there's not too many conditions that actually cause those kind of rashes. But those poor kiddos, oh man, it hurts, and they don't want to feed. And a lot of times you'll see them just drooling like crazy. Just some things. Wasn't that long ago that we were having norovirus going around? Norovirus, terrible, terrible, vomiting, diarrhea. But I mean, it would be, I mean, almost soak it into the diaper completely, nothing left. And so those are just a few. But even the common cold at this age can be because their immune systems are brand new. And of course, those moms that are breastfeeding are really going to give their kids a heads up because they are those little babies are getting the mom's immune system factors from that breast milk. But I mean, their bodies is just so new to all these viruses and everything in their environment. So really, all these viruses are still a big deal.
Yes, which is why we're glad to have you on today. We'll
Yes.
talk through, some of the concerns with them, and don't worry, parents, because we got you with this topic.
Yes.
So the next one is, what is the best way to take a baby's temperature?
Yes, great question. When you are in the newborn hospital, the nurses are going to come around every 4 hours, and they're going to take your kiddo's vital signs. One of which is going to be a temperature. Now they're going to use a thermometer, and they're going to put it under your little kiddo's armpit. Now, that's an okay way of taking temperature. But it's so given to outside factors like are you overbundled or underbundled. And so we generally say, especially that first month of life where that fever is a big deal. We actually recommend doing more of a rectal temperature. Now there is special thermometers for these ones. It will say rectal on there. They are a lot of times a different shape, just so you don't get it mixed up, then put it in the mouth. Yes. But you only stick that little thermometer in just that little itty bitty metal part, just quarter of an inch, and that is going to be the closest core body temperature. So that would be the way we'd prefer for those newborns. And really, when you stop taking that kind of temperature, it's when they stop allowing you to. Then after that, then you got the ones that can go in the ear, can go on the forehead. I mean, those are not as accurate. We all know take the average of 3 from those ones there. If you don't believe the number, check yourself and see if it matches up. All good things to keep in mind.
Yes. What should I do if my baby has a fever? And maybe with this question, if you could touch on maybe how old they are when they have
Yes.
that fever.
Perfect. Yeah. So any fever under the age of 1 month, this is kind of a big deal. I would always say, if you feel like your baby's not doing, is maybe sick, feels a little warm, check them. Now, uh, we've actually done studies. Now, I mean, pediatric world have done studies looking at how good are we as parents for doing the whole forehead, are they have a fever thing. Well, they found out if we do not feel like they have a fever, we're actually pretty accurate. Now, if we feel like they do have a fever, we're only 50-50. So the moral of the story is you only need to take your kiddo's temperature if they feel warm. But this first month of life, any fever of 100.4 or greater, we would ask you unbundle them because we tend to overbundle and underbundle. Recheck in about 10 minutes, and if it is still high, 100.6, I would tell you this is a reason. Get yourself dressed as you're running out the door, and they got to be seen right away. And it's one of those things where I wouldn't want you to wait for someone to come home first, or oh, it's almost the daytime, 6 a.m. No, it's like you want to go right away because if there was a bacteria going on, the doubling time of bacteria, you go from 1 to 2 to 4 to exponential. It can happen pretty quickly. So a matter of hours could make a big difference in how sick your kiddo gets. Now that's gonna be up to the 1 month age. Now 1 month up to 3 months. Now, if they do have a fever, we would like to see them at least the next day. Okay, that'd be an important thing. After that point there, because our kiddos are going to get sick. Now it's going to be based on how are they doing? Are they feeding well? Are they working hard to breathe? How many wet diapers are they making? These are all the other things that we start looking at, and then kind of and then of course it's never wrong to give the clinic office a call. All of our clinics have fantastic nurses that have all the answers ready to go. They're all experienced, and so they can give some great advice. And if there's something they can't answer, they send it to us doctors, and we get those calls and then we answer those as well.
Yes,
Yeah.
for sure. So, you just mentioned calling. When should I call my doctor if my baby is showing signs of being sick?
Yeah. So the first of all, yeah, the under 1 month. you can call us. We're all going to say the same thing. Get them down to the hospital. That 1 month to 3 months, like I said, we're going to probably get them the next day. This goes back to once again. At different ages, you kind of have to use. At this time, you start knowing them. You start knowing how they do things, how they act when they're feeling good and when they're not feeling good. This is when a lot of times you do have to listen to your gut instinct on these things. What does a kid look like that has an ear infection? Well, we all hope that a kiddo that's pulling on an ear, right here, dad, right here, mom. But not all kids do that. We know working kids that are working hard to breathe. Okay, so that's going to be sucking in below the ribs, sucking above the ribs. Nose is flaring open when they're breathing. They're breathing quickly. Once again, your gut says this is not good. That would be a reason to give us a call. The wet diapers would be a good way to determine dehydration. So, under one year, they really need to get 4 to 5 wet diapers in a 24-hour period. Now, they don't need to be soaked diapers. They just need to be that little color change on the diaper. As long as that's happening, that's gonna be another one thing. If they're not making as much poopies, that's okay, unless you think they're getting constipated. And of course, if your kiddos go to daycare, a lot of times they will post, this is what's going around. So you gotta have a clue for what to look for. But a lot
Mhm.
of times it's gonna be that gut instinct, like, yeah, this just doesn't look right, or I'm concerned maybe they have an ear infection, or of course, as your kiddo, gets, more times of getting sick, you're gonna get a better understanding for how they act and how they do when they are sick and when they're just a little sick.
Mhm. Yes, and I see some great questions coming through on some of the things Dr. Ryan is
Right.
talking about. Just so you know, we will do a live Q&A at the end, so keep those questions coming and we'll get them answered here in due time. What can I do to prevent illnesses from spreading?
Yes. Now this is a loaded question because in some ways not much, but really there is. Washing your hands. Now, I think everyone say, "Oh yeah, you should always wash your hands after change your kiddos' diapers." Does it always happen? Probably not. But wash your hands can be a very important thing. This is going to be making sure they're well hydrated. This is one thing. Running a humidifier is another one of those things that help. Especially in the dry months, like the winter months, when we run our heater so hard it dries out the air. That dry air is not great for our nose. It gets more swollen, more stuffy, and which then promotes things like a virus or something taking hold and doing this thing. I always think those are very important things. Really, people talk about, oh, do I need to give my kid vitamins? Well, you do need to give your kid vitamins, like vitamin D if you're breastfeeding, or, sometimes they're not having a good diet. Maybe got to get them iron. But really, just a good healthy diet is going to be the best thing that you can do for them. Otherwise, yeah, it's now if you're sick, I mean, it's okay to wear a mask. Especially moms that are breastfeeding. You have a respiratory illness, wear a mask because it's just so you're not breathing right on your baby. That's an important thing. I sometimes joke, but moms are not allowed to get sick. So uh, us dads, we can get sick, and family keeps on moving. Mom gets sick, not a good thing. But with all due respect, and then be kind of cognizant of, there's just sometimes we know there's a lot of things going around, or you're going to be around a lot of people. Maybe when you're, at certain times of your kiddo's life, maybe you're not going to be going to those things just because it would be easy to bring him home.
Yes. The next question is, I'm sure a lot of people probably feel this way, the way it's worded. My baby will be going to daycare. Am I doomed?
Well, if I, I'm not much of a betting man, but if I had to make a bet here, I'd place probably will get their first sniffles within a week, if not two. It's very common. There is different times of the year where there is more sickness going around. You know, post post COVID apocalypse, it's been kind of really all over the place. Typically, it'd be, oh, summer months are great months, and so, um, but it's but kids, they have to build up. They're going to build up their immune system, and it's kind of gosh, I'm not going to send my kids to daycare. Well, then it's going to have to happen eventually. I think that's always going to be one thing. At some point, we all have to get those illnesses to go through. Now, granted, maybe it's better when they're older and bigger, but a lot of times life necessitates our kids, having to go to daycare so we can work and make a living and provide for our children. So there's definitely we shouldn't feel bad about doing that. But will they get sick? Yes, they will. And I mean, you could go to a daycare where the daycare provider is diagnosed OCD. and they can clean things 5 times, 10 times over before they feel good about it. These kiddos are still going to be spreading things. It's like kids. They touch their nose, they touch a toy, they give their toy to their friend, or here, share my pacifier. It, I mean, they invent ways of getting each other sick. And my daughter works at a daycare right now in preschool, and every day she's telling me all these crazy stories. I'm like, yep, that's exactly what happens. Kids just share things, and so once again, it's you hope for the best, but making kids as healthy as possible. Definitely, another plug for breastfeeding here. Breastfeeding kiddos, their body fights this stuff off a lot better. I mean, we don't have to do a scientific studies to show us, which they've done, but we don't have. But it's so easy to say, yeah, the kids that are breastfed, they don't get sick as often, they don't get as many ear infections, they don't get as many respiratory infections. So that would be, definitely one plug for that once again. But yeah, are they going to get sick? They will. And could you expect within a week or two? Yes, unfortunately.
Yes, it's good to know.
Not doomed, but yeah.
Yes, it's likely, right. This one says, how soon can I take my newborn out of the house? I am worried that they will get sick, but also, like you said, want to build their immunity and take them places and get out of the house.
So this question has a lot of, and it's a great question. It has a lot of things kind of connected to it. The big answer is we're even a virus, and that gives your kid a fever that first month of life is going to be a big deal. And I say a big deal, like we put them in the hospital, we are going to get a blood work. We are going to get a chest X-ray. We're probably going to have to cath them, for urine. We're gonna probably maybe even have to do a spinal tap. That's where we stick the needle in their spine. There's a kind of lot of things that you just don't want to see. I remember when my daughter was 2 months old, they had to do this for her when she had a bad illness. The worst thing in the world is seeing your little baby scrunched into a ball with a needle being stuck in her back. And of course, my poor little Eden was the chunkiest little baby, and so they couldn't even get an IV, and they had to put a scalp IV through the soft spot. Now, this is all before I was even a doctor, so it freaked me out. Um, yeah, would that make me want to maybe be a complete hermit for the first month of life? Absolutely. Do I still remember? Do I still remember the fear from that? Absolutely. So it's not wrong to keep your baby home. I would definitely say don't take your baby out places that where it's not you don't need to go. Like don't take them to the grocery store. There is and I'm sorry if those weirdos are out there, but there's people that will just touch your baby without asking still. Just not cool, not cool. There's maybe you don't take your baby to work or church or mass or where you're going to feel obligated to pass them around. I know this is the big issue, around the Christmas time this last season. A lot of those questions, like, because yeah, that's a time of family. But on the same hand, I will tell you, it is important that we do share our bundle of joy, our happiness we're with our family, and it is important to go and still live life. I think those are so very important aspects to this, and that's where a lot of times it also comes the way you answer this question is, well, what do you feel comfortable with? I mean, if you are going to be absolutely getting a gastric ulcer and be staring at your child for 24 hours a day, worrying that maybe because you took them out, they're going to get sick. That's not great. That's not great. Kiddos are really weird about this. They pick up our energy. They pick up our moods, and of course, they don't know how to internalize this kind of stuff. And they definitely, sometimes babies are fussy because we're just so stressed and we're so nervous about these things. And for those kind of families, I'd say stay home. It's not worth the stress. If you're going to go out, go outdoor things. Now, it is warming up. This is going to be, we're really keeping our fingers crossed here that we start getting some better weather. But going outside, very safe. Outdoor venues, very safe places to be. It's where you're kind of stuck, crammed with a lot of people around. That's it. So yeah. So that question is a great question. And I would always say, that first month of life is going to be the big deal. So if you're gonna, if you play safe, I'd say absolutely stay home. Stay home. Stay home. You don't go out if you don't need to with the baby. Make sure you have good, wash your hands, you come home, that kind of stuff. But there is a balance. There is a balance, and you have to really kind of go what you feel comfortable with.
Yes, that's a great answer. The next one says, can you talk a little bit more about the immunization schedule for babies so we know what to prepare for?
Yes, absolutely, and of course, immunizations are very important. There's a reason why we do not see a lot of these terrible illnesses because we have prevented them. I mean, heaven forbid, I don't ever want to see polio. I don't want to ever see polio. And that's been because of vaccines. And I know there's been a lot of fear with vaccines, just a lot of questions, a lot of questions, a lot of people questioning things, especially with the COVID vaccine that then kind of bled over into what about all the other ones and what do these things mean? And, there's a lot of bad opinions out there, a lot of bad, when especially these, you got to be careful with scientific studies sometimes because you can make a scientific study say whatever you want, and people will manipulate these things to kind of support their own agenda. And it's hard because once again, post-COVID apocalypse, we don't really trust anyone anymore. And not me as a doctor, I'm just another one of those talking heads. I understand that. But it's vaccines are very important. This is why we don't get these terrible things. And of course, we don't make vaccines for nothing, for no good reason. I mean, they have to be things that would be easy to catch, things that are like if you got them, it would be cause significant disability or death, and of course, things that would be easy to produce and give to families. And so these vaccines are very important. Now, at the hospital, you'll probably be offered to give the baby the first hepatitis B vaccine. Now, a lot of people are like, well, I don't want to. Why do we do that? Do we need it? The hepatitis B is something that potentially, if you as a mom had this, you would give to your child, and giving them that vaccine at birth is significantly important to reduce that. Now, you're like, well, we're in a good relationship. We know, and this is most of the time you are absolutely correct. Can I tell you stories? Yeah, I can tell you stories, and I'm not going to do that because they're sad. But but this is not. But the other big reason why it's not a big a deal to give that extra vaccine because your kid might end up getting four is overall the hepatitis B vaccine. Some people don't make as good a response to that as others, and so it's not uncommon that for especially us in the medical field, when I had to go to medical school, I had to prove that I had immunity. I took like nine of those just to basically be able to be protected. So it's not unsafe at all. In fact, I'll tell you, this is one vaccine that, yeah, it's not a, it's you might actually need it someday. But you'll get that at birth. One thing at birth too, it's not vaccine, but a lot of times they'll put an ointment in their eye. That's an antibiotic ointment. Once again, especially the babies that are born vaginally, they're going through an area that has natural bacteria in there, which is great there, but not necessarily in the eyeballs. So it's definitely a very safe thing to do. They'll also offer a vitamin K shot. Now this is actually to help stop bleeding. So it helps with clotting. So you think about all the just sometimes going through the birth canal or just sometimes just being removed by C-section. This would help you not bleed, and so it reduces the risk of head bleeds and things like that, which is I think super important. If you don't know why they're giving them, a lot of people deny these things, but they are really there for a good reason. We don't want to give things to your kiddos if you don't need them. I always think that's important. Important thing. If your kid doesn't need it, don't do it. But this will be one of those things. Yes, very important, especially if you have a boy that wants to be circumcised. Yeah, he'll need to get that too. But vaccines. So you get that one at birth. After that, of course, we'll probably see you 2 or 3 times after you get out of the hospital in the clinic. We all have you come back around the 2 months old. Now, the 2 month checkup is going to be a lot of growth, development, feeding, but it is a vaccine visit, and that would be kind of that first set. We give it. A lot of times we give the same set at 4 months. Many times 6 months is the same ones, maybe plus or minus one other one. Um, uh, Usually like the way our clinic does it, we don't usually give a 9 month shots, but then we have a couple at 12 months, a couple at 15, 18. And if you did everything perfectly timed, you're done until they're four. There is some leeway. I know I've been at clinics in the past where they actually gave one vaccine at 9 months. They maybe sometimes what they give at the 12 month and the 15 might be a little mixed up. But essentially the first big set is going to be a combo of some sort of going to be a polio, a hepatitis B, and that DTaP, which is DTaP is diphtheria, tetanus, and pertussis, which is whooping cough. That's what that protects. The way our clinic does right now, second one you're going to get is a Hib vaccine. Now this one actually prevents meningitis in babies. Now this is really the biggest risk factor for us for that Hib is at this age group, and so you'd get one of those. You'd also get a pneumococcal vaccine. Now this is pneumonias, meningitis, which is, yeah, we don't want any of our kids getting that stuff. And then the other one that we give is for rotavirus. Now this is an oral one, which is all right, great, not a poke. And rotavirus is another one of those just terribly nasty GI illnesses where around the world actually kills a lot of kids if they don't have access to clean water or healthcare. Even if you are here in the United States and get rotavirus, you're going to probably get in the hospital. I mean, it's terrible. It's a terrible one. So, that would be that first set. And a lot of times you get that same set when you're 4 months old, and at 6 months you usually get the same pokes, plus or minus, depending on what your clinic does as far as that rotavirus. Sometimes there's a 2 vaccine series or 3 vaccine series. So that would be kind of the big first step. And of course, it's not until 1 years old do you get that measles, mumps, rubella, chicken pox. So a lot of times you'll get another of that first hepatitis A, which is a different type of hepatitis, the one you get from food and whatnot. But that would be the start of it.
Yes,
Yeah.
thank you for the
Uh-huh.
detail, especially it's good to hear about all the different ones, so
Yeah.
thank you. Okay, great. We're going to go ahead and jump into the questions here in our comment section. So if you're on live and you still have a question for Dr. Ryan, now is the time to comment and we'll get through as many as we can before we draw for the giveaway. So awesome. Let me scroll to the top here. Thanks everyone for leaving such nice comments. Okay, so the first one is, do you have thermometer recommendations for babies? Is there like a brand you like or anything?
Not a particular brand. It's more of just making sure and granted, a rectal thermometer is exactly the same as an oral thermometer or the other types. It's just that it's just designated as rectal, and I'll tell you that's probably the important most important part. Like I said, just I've I have had stories of patients that didn't realize that they were using their little siblings' rectal thermometer when they took their temperature, and that was quite the rude awakening for them. So as far as brand, no, it's more of just making sure that you know which one is for which. A lot of these are battery operated. Just a little plug out there. If the temperature is really low, and then you take your temperature and it's really low, bad batteries would probably be the culprit. So just remember, if you get a really low temperature, it's probably because the batteries are going bad. But otherwise, but brand, no, no. But yeah, it's definitely you want a lot of the baby kits actually. A lot of those, they call them starter sets. Have a lot of have one in there too.
Awesome. We got this question to our inbox. Is there a way to truly prevent or greatly limit newborn illnesses? I know you mentioned breastfeeding as one
Yep.
way to prevent, but
Breastfeeding is going to be huge here, and this is if I had to say there's one thing, if you had to do one thing, breastfeeding would be it. Absolutely. Or if you couldn't breastfeed, pump and, breast milk. That's still getting the goods. It's still getting the goods. That is going to be the biggest and most important thing. After that, it's going to be if you have the ability and the luxury of not having to take your kiddos to daycare. This is a sacrifice. I know for a lot of families, actually make the sacrifice of that would probably be the next big thing, honestly, because that is it is a petri dish. It is. After that, it's really about just healthy living, and this is gonna be where just the whole family. Good hand washing. Yes, maybe you're gonna Clorox wipe things down. Especially the changing tables and things like that. And after that, it's gonna be really just being healthy. And some families, their immune systems are just amazing. And then I have some families where they're doing all the right stuff, and despite that, their kiddos are still getting sick. And there's it's yeah, sometimes I don't want to call it bad luck, but
it happens.
yeah,
Yeah,
blame your grandparents. I
it's
know.
hard, right? The next question is, I am extremely lactose intolerant. At what age should I start looking for signs that our child might be as well?
No, that's a, it's rarer for little ones to be lactose intolerant. I mean, you think back before we had the luxuries of formulas and grocery stores. Well, what would you have? I mean, if you couldn't breastfeed them, it's like, all right, your goat milk in it. But most kids are not lactose intolerant. Now, as we get a little older, sometimes we can see those things. And now, what are you going to be looking for? Um, Diarrhea, sometimes crampiness. Sometimes it could be more, or milk can also be an issue that causes constipation as well. Um, but you're going to be looking for a lot of times gassiness, diarrhea, bowel changes. Where you should have normal stools on a normal basis. All right, it's not that anymore, and that would be, I would tell you, would be one of the first things that you would be looking for in general.
If diarrhea is present, what can we do to hydrate our baby? Is it still only formula?
Absolutely. And if your kiddo will tolerate formula, give them formula. Or if they'll tolerate breast milk, breastfeeding, do that. Let's just say though that they're not. It's because it is heavier. It is heavier than say water. If you had to, you could absolutely go and use something like Pedialyte. Pedialyte's a very safe thing to give kids. Because at the end of the day, yes, Pedialyte does not have calories in it, but you can go a long while without calories. You can't go very long without hydration. And the hydration part is tough because when they start getting dehydrated, well, they don't feel very good, which means they don't feed as well, which means they don't hydrate more, which means they're going to get more dehydrated. You can see how it's a vicious cycle. And plus, especially when you are having, especially diarrhea, you're losing a lot of electrolytes. So this is where, like something with electrolytes in it, such as Pedialyte, would be a great product because you do need to replenish those. Uh, I don't like doing Gatorade until they're at least one, and even then, I would say water it down. But Pedialyte's fine. If they start getting a little older, this might be more of a taste buds kind of issue here because when they're first born, not working so well. That they don't distinguish taste too much, and so the plain peanut's fine. Try it yourself. I think every parent should do this. If you ever give your kid a medicine, try it yourself so you know what you're working with, or a formula, know what you're working with. Pedialyte's really not very good. There is flavored Pedialyte, so at some point you might need to be looking for that. Is why they're snubbing their nose towards these things. But that would be you do Pedialyte would be a good alternative, and you could do a little water, especially as they get a little older. You just once again, it's all about keeping them hydrated. Watch those wet diapers.
Awesome. Can teething cause a low-grade fever, or is that truly a myth?
No, it would be much more of a pain response. And so I always tell my families, if it's over 101, that's illness. That's illness. If you're just a low grade fever, 100.2, that can be potentially be teething. Like it all really depends. Now, if your kiddo is not, if they're not having pain at all and they have 100.8, well, that's probably illness too. But a lot of times it'll be more of a pain response more than anything. And of course, some kids do teeth very gracefully. Some kids do not. Once again, it's just you hope for the best. But no, you can get it'd be low. It'd be low. 101 would be. I mean, I would tell you, I don't think it'd be very rare for over that. With that being said, I feel like whenever your kid is teething, it's usually when they are sick. It's kind of more insult to injury. I don't know if it's a Murphy's Law thing or I'm just being jaded because it just seems like I see so many kids that have ear infections and they're teething, or they have a cold and they're teething. Just to add, but yes, but so definitely look for the temperature, look for all the other signs too.
We got a few questions surrounding visitors after baby is born,
Mhm.
vaccinated people visiting versus unvaccinated people visiting. Do you have advice for that?
Oh, this is a tough one.
Yeah.
I'm a family guy. I think family's important. I think sharing our family is such an important thing. Um, the thought of having to say no, you can't come over, just devastates me. It does. But I, at the same time, the thought of them potentially getting something like measles, and because that we've had outbreaks here, we have, and that spreads very easily, to the point where you're in a room with 10 people and you're hanging out for 10 minutes in there, and you all leave, and none of you were vaccinated. All but one is leaving infected. I mean, it's very contagious, and of course, my baby cannot get that vaccine until they're 1 years old. Does that scare me a bit? Yeah, because that that ruins brains. It does. It's terrible. Um, and so this is the part where personally, I'd say with my baby, if you're not vaccinated, maybe you don't get to come. Flu. I think a lot of people kind of look at flu going, it's just the flu, just influenza. Um, Kids die from this. Kids get very sick from this. We put kids in the hospital from this. Um, uh, and that's just such an easy thing to get. I mean, and so for me, that would be one thing during flu season. We're running out of it now, but I think that'd be an important one to have, especially if those moms are going to be delivering later on in September, where we had an early flu season. I think this is important. I think a lot of times the moms are always getting they're getting Tdap's boosters. Dad has to get one. Dad should get a pertussis booster as well, as before the baby comes. COVID is another one of these big topic issues, and this is a tough one here because there is so much more than science and medicine when it comes to the whole topic of this vaccine and this illness. A lot of political, a lot of almost, I mean, this belief system kind of stuff. I feel like you have to go with what you feel comfortable with, and this is at the end of the day, this is the advice I'm going to give you is just know there is a risk, and just you at some point you have to find what is that happy medium. Do they have to have their flu shot? Do they have to have their COVID vaccine? Do they have to be boosted up? You have to really go. You have to go by what you feel comfortable with. I have a lot of families that are very anxious about it, and yeah, they're asking my opinion on this, and I'm like, this is kind of tough. This is really you have to answer this question for you. In a perfect world, everyone would just do this, and everyone would be good hand washing, and everyone would stay home when they're sick, and everyone would. But we all have those choices. But what I recommend people, yeah, I mean, if they don't have the basics, I mean, it's a scary thought. It's a scary thought, and so but that's a tough one. That's a tough one to tell your sister. It's a tough one to tell your brother, your parent, your grandparent. That no, you can't come over and see my child. It's a tough question. It's a tough question. Yeah.
Yeah,
Hope that helps.
it does. It
Yeah.
does. Okay, we'll do 2 more live questions and then we'll draw for the giveaway. So, let me pull here. And I see a couple questions about, formula and breastfeeding stuff. Tomorrow we're covering feeding with Dr. Katie Wilcoxon, so we can cover that then. What about using a humidifier when a baby is sick? Good idea. Should we keep one in their room or
Oh, 100%,
no?
100%. This is hands down a very important. It's hard. We don't have much to treat kids with. A humidifier is going to be one of those very important tools we have. Where when it gets dry out, our nose gets stuffy by itself. We need moisture. If we have a cold, the mucus gets really thick. That moisture helps break things up. And so this is one of those things I will tell you is, I mean, as we don't have much, but this is such an important thing. I will tell you, when you get sick, parents, use this yourself too. Now there's a humidifier and there's a vaporizer. They're different. Vaporizer is gonna be more of a warm mist. Humidifier is more of a cool mist. If you were to probably pull our office here, you probably get probably a 50-50 split on which one they'd recommend. Now I'll tell you, I think the vaporizer works better. Because that's more natural for our body than the cool mist. But I'll tell you the risk factor here is that what does every kid do when they see steam coming up? They put their face right over it. That would burn them. All right, so that would be one of those things where, maybe as babies, all right, you can use the vaporizer. As they get older, you might have to put the vaporizer up high so they can't get it, or really just go with a humidifier, which would be the next best option. But 100%, this is huge. Other things, as we're on the topic of what else can you use for your kiddos, um, uh, the bulb suction. Bulb suction is great for getting puke out of the mouth. It is terrible for getting snot out of the nose. They have things now where it's actually you actually suck on the other end of it. You need to get those. You need to go. There's a lot of different brands of those. It sounds like a very gross and disgusting concept. There is a filter. You are not going to aspirate at your baby's booger, okay? But you could actually get so much more suction because your nasal cavity goes here all the way back to that's a long ways, and you're not getting nearly enough for the bulb suction. So get one of those suction devices. Those are super important. Sometimes getting some saline. So doing a couple drops of saline drops in the nose, and then followed by suction. Your baby will hate it, but saline breaks up mucus, and then you can actually get it out because when they can breathe, they feed better and they feel better. Tylenol. We gotta say if you're gonna get Tylenol young, you got to make sure you run it past this because it's all weight based, so their weights are always changing. We don't give ibuprofen until 6 months old. Um, there is no cold medicine for kids, little ones at least. Not to a little older. Maybe when you're one, maybe we can try a little bit of Benadryl because that will help a little bit of the mucus. Not going to fix it. But once again, it's all weight based, and that's why a lot of times if you look at the packaging, you're going to see that these are it'll say contact your doctor because and it's not always even your age because we know that some kids are really big for their age or really small for their age, so it is weight based. So definitely. And that's one thing we should always be discussing with you at our well checks too. But those are some things that I think are super huge, very important.
Perfect. All right, let's do one last question and then we'll draw for today's giveaway. So we had a couple questions in the comments about vitamins. Can you
Mhm.
touch on when to use them? When will they help? Probiotics, things like that.
Yes. Well, if you are exclusively breastfeeding, you need to do vitamin D drops. Okay. Our breast milk just does not have enough of it in there, and our kiddos need that for their bone and for a lot of other things in their body. So that's always going to be a very important thing. you really actually have to be taking quite a bit of. So let's say you're doing, some formula, some breast milk. You really have to have a majority formula for you to actually even get enough vitamin D not to need the drops. Now, even then, I would tell you some of our nutritionists, dietitians will still say give the kids vitamin D drops. It's one of those things where it's very useful. If your body doesn't need it, it just gets rid of it. Iron would be another one of those things you'd have to kind of be discussing about. If your kid is full term, you could usually hold off and do an iron until about 6 months old. If they're early, 36, kind of earlier than that, they will probably need to be on iron as well. A lot of times, moms give a lot of their iron to their babies that last 2 or 3 weeks of the pregnancy. Um, Kiddos that do get iron in their diet by baby foods, after 6 months, can sometimes avoid doing the iron drops just because, well, taste them, they're disgusting. But other than that, like probiotics, once again, this has been one of those things that's actually a lot of studies show they're very helpful. All of our kiddos in the NICU are usually on a probiotic of some sort just because of their body's under a lot of stress. You need to build up that gut health. Can you overdo it? Yes. But generally speaking, it's usually a healthy thing. Cultural has a couple good products, especially when they're a little older too. You can get the yogurt that's meant for gut health. It has the probiotics in there. Those are fantastic. Definitely, it's now I do know people do kind of try to take this too far, and they try to fixing constipation of this and a lot of other things. Yeah, I mean, it's sometimes more hopeful than others, but it's definitely a safe thing to absolutely do. Mhm. And
Awesome.
and moms, make sure you are taking a prenatal vitamin after you deliver. You're probably anemic. Gotta do it. So I'm just putting a plug in with those OBs as well. Okay.
Yes, we appreciate it. Okay, I know there's still some comments that we didn't get to, and I'm sure later this evening, after this video concludes, we'll probably get a few more. So if we didn't answer your question live, know that I will email them all to Dr. Ryan today, and we'll get a response for you. So keep your eye on your inbox because you'll get a message from Boys Town Pediatrics with your question answer if we didn't get to it. So thank you, everyone. So we went ahead and entered all the names here for the giveaways. Let's spin the little wheel on my phone here. All right. Looks like Aaron H is our winner. Congrats, Aaron. Please
Congrats.
message us with your email and we'll coordinate getting you your prize. Okay, sorry. I think I froze. Did you see the winner? It was Aaron H. Did that work?
I saw you.
Okay, good. Okay, I'm just making sure. I saw myself froze, so I wasn't sure. Wonderful. Well, Dr. Ryan, thank you for
You're
your
welcome.
time and thank you for all the detail you go into. It's very helpful. Like I mentioned earlier in the video, tomorrow we're going to be live with Dr. Katie Wilcoxon to talk about feeding. So, breastfeeding, formula feeding, all of the above. So, make sure you tune in for that. We'll be live at noon Central Time and we'll see you then. So, thank you everybody. Have a good one.